Hello everyone, my name is Nicola. I'm a vet and a PhD student at the Veterinary Teaching Hospital of the University of Perugia. Welcome to the video abstract of our case report entitled Computed Tomographic Diagnosis of a Fracture of the Floor of the Pelvis in a Thoroughbred Foal. Young horses, especially foals and yearlings, seems to be predisposed to traumatic pelvic fractures. The most commonly used imaging technique for the diagnosis of pelvic fractures in adult horses are radiography, transrectal and transcutaneous ultrasonography, and nuclear scintigraphy. For this reason, computed tomography has to be considered as a very effective diagnostic imaging technique in foals. Our case report focuses on the clinical and diagnostic imaging findings, treatment and outcome in a 50-days-old thoroughbred foal referred for evaluation of severe left hind limb lameness and difficulty to raise of 8 days duration. At admission, blood works showed an increase in serum amyloid A and fibrinogen values. On clinical examination, the foal showed a severe left hind limb lameness at walk and trot in a straight line and on the mare. No significant abnormalities were detected at palpation. A radiographic screen of the left hind limb was performed, but it was considered unremarkable. An ultrasound examination of the pelvis, thorax and abdomen, including the umbilicus, only showed small and diffuse cometary artifacts, identified in the cranial portion of the lungs. So, considering the risk for occult infection on the basis of the blood analysis results and the age of the foal, we decided to perform a CT examination. This is a CT reconstructed image showing the close, slightly displaced wedge-like fracture of the caudal ramus of the left pubis, with involvement of the medial ramus of the left ischium. From a transverse CT image at the level of the middle part of the pubic symphysis, bone discontinuity and fragmentation of the caudal ramus of the left pubis can be seen. There is a mildly displaced bone fragment at the medial aspect of the left pubis, and faint new bone formation is visible on the lateral and medial margins of the left pubis. From the dorsal multiplanar reconstruction CT image of the pubic symphysis and table of the ischium, we can identify the inverted V-fracture configuration of the left pubis and medial ramus of the ischium with a fragment. The thoracic scans demonstrated the presence of close, transverse, mildly displaced fractures with bone callus formation at the level of the distal aspect of the 6th and 7th right ribs, most likely related to birth trauma. Anti-inflammatory and antibiotic therapies were administered during the hospitalization. Improvement on clinical parameters and blood analysis were observed, and repeated blood tests after 4 days revealed a decrease in SAA and fibrinogen values. The foal was discharged after 9 days of hospitalization. Mare and foal were restricted to box rest for 3 weeks and a small paddock for additional 3 weeks. 3 years later, at follow-up telephone interview with the trainer, the horse was in full athletic activity without any residual gait changes related to the fracture of the floor of the pelvis. Career information were achieved for a racing website, and the colt raced 18 races during his 3rd and 4th years old racing year, where he placed first once, second twice, and third 6 times. Additional details are available in the full paper. Thank you for watching our video abstract.